So here we're going to be talking about a 37-year-old man comes to your clinic because he feels he is changing, easily angered and forgetful. He has cognitive decline and is worried because his father died at the age of 48 after a few years of dementia, spontaneous twitching and dance-like movements. What condition is the patient at risk of developing? So this is a 37-year-old man, and typically the disease that we're going to be discussing today affects people in their third generation of life. Third decade of life. And actually, by that standard, also different generations, because we're going to talk about how this disease is increasingly more penetrative in certain families when the dad also has the disease. Now, that's a concept known as anticipation. But before we move on to that, this is Huntington disease. And in Huntington disease is a progressive neurodegenerative disorder which is autosomal dominant in inheritance. So it's autosomal dominant in inheritance. It is progressively neurodegenerative, so it's also a neurological condition as well as a genetic one, because it's primarily affecting the striatum. To be even more specific, it affects the caudate and putamen. And so Huntington disease is actually something called a trinucleotide repeat disorder. Or even trinucleotide repeat expansion disorder, and it is characterized by, let's go back to the clinical vignette, it is characterized by dementia. So here's dementia, spontaneous twitching and dance-like movements. Now this dance-like movements, the medical term for that is chorea. This is a term that you need to be aware of, chorea. And I'm assuming that this twitching is also this involuntary movement, but when it's in the extremities as well, this slow writhing movement that just kind of you can see in their hands, it's like this slow snake-like movement, slow writhing movement in their hands. That's known as athetosis. In chorea is this dance-like movement in which the whole body is involuntary movement. And this image this image is from BetterHelp. I put the reference there, but I don't know where it's gone. And they have these kind of dancing movements, athetosis, which is their slow writhing movements of their hands and extremities. So give it a quick YouTube search and you'll be able to see what that looks like. Now, in terms of what Huntington disease really is, so it does bring a lot of mood swings and kind of more so aggression, because they're forgetting things. And if there is family history, so worried about his father died at the age of 48, remember it's autosomal dominant, so they're 50% likely to inherit the disease, and especially more so if it's a trinucleotide repeat expansion disease. Now, why do I say that? Why are these patients more at risk than just the normal, typical autosomal dominant type of inheritance? Okay, let's explain that. So, if I just get rid of that. Oops, got rid of that too. Oh, we just cut out the whole thing. Okay, sorry. So, okay, that's enough. Let's talk about this. So, when it comes to Huntington disease, it being a trinucleotide repeat expansion disease, what does that really mean? That means that at some point these patients have in their genome, they have a CAG repeat. And this CAG repeat, you know the nucleotide bases, cytosine, adenine, guanine. So this CAG repeat is repeated more than 40 times within their particular genome. And this causes them to have the mutation, to have Huntington disease. Now, this CAG repeats, CAG in itself actually codes for glutamine, and having a repeat, maybe one or two repeats, maybe 5 or 6 repeats, fine, or even less than 26 repeats would be a normal patient. But having more than 40 trinucleotide repeats gives that person the disease. And why did I tell you that it codes for glutamine? Because we're going to get into how exactly it's causing disease. But before we get onto that, it affects the HTT gene, or the Hunting. Now, it's not spelled the same, so be aware of that. It's spelled like that. The Huntington gene, the HTT gene, on chromosome 4. Okay, and this codes for the HTT protein. And while there's ongoing research about what this actually does, it does cause damage. And overall, in Huntington disease, there is neuronal death. And that's what's causing this progressive neurodegeneration, because there is this neuronal death aspect, and that's what's causing this progressive neurodegeneration. Now, before I go more into depth about the genetics, let's just talk about these main symptoms. So these patients have chorea, which I explained was the dance-like movement, athetosis, which was the slow writhing movement. And it's really interesting when you actually see these patients and you're able to diagnose based on that. It's quite, it's a cardinal symptoms. The other symptoms are that these patients will get dementia and cognitive impairment. And another thing, these patients typically have early death, and while this can be related to the neurodegeneration, it's also often linked to suicide. So that's something important for STEP as well. Now, let's go back. So what happens is, I told you that CAG repeat coded for glutamine. Now this glutamine kind of forms this poly-Q tail, and having this poly-Q tail, it will then modify the Huntington protein, if you're interested. Huntington protein, and that will then link back to the neurodegeneration. There's also something called the Krebs binding protein, if you're interested, but look that up. So because I want to move on to the key genetic principles that you should be aware of, or just a couple of key facts about this. So what you need to be aware of is that, because this is why did I say that these diseases are even more likely to be expressed in the patient or the child? Because these are dynamic mutations, meaning that the expression of that particular phenotype is heavily linked to the number of copies of the repeat of the CAG. That's what a dynamic mutation is. It's whether or not they're going to get the severe Huntington disease is whether or not they have more than 40 copies or less than 26, which would make them normal. Now, that's a dynamic mutation. Now, what makes this even more likely to actually occur is anticipation. Anticipation is when the greater the expansion of the trinucleotide repeat, I'll just put TNR, the earlier the age of onset in successive generation, earlier age of onset. So on this channel, I like to put things in equations and algorithms so you can easily understand. So having a more expanded trinucleotide repeat will deliver an earlier age of onset in, of course, successive generations. Now, that's pretty much almost it. But so therefore, if the father was affected at 48, given that the child also has the mutation, they will more likely to start showing signs at 37. Fine, it depends on the number of copies, but due to this whole concept of anticipation, which is, let's say they have 25 repeats, then that might expand by, I don't know, 6 or 7, and that might become 31 or 32 repeats in the child. However, that is still pre-mutation or reduced penetrance. That doesn't mean that the child will have the effect. However, if the father had, let's say, I'm just eyeballing it here, if the father had, let's say, 36 repeats, then in the child it might go up, it might expand. And this is typically shown in anticipation. The child's repeat might expand to 40, which will mean while the father was asymptomatic, the child will have the mutation and will have the disease. CT scan, CT imaging is very useful because you can actually see kind of the striatum, and you can look out for the basal areas of the basal ganglia having degeneration, or atrophy can be seen on the MRI.